Hello everyone, thank you so much for tuning in. Today we're going to talk about something very, very important, and this is mental health. I have with us Dr. Cotton from the UNR School of Medicine. She's an assistant professor there, and she has a wonderful amount of information for us here today. Welcome, Dr. Cotton.
Thank you for having me.
Right before we started this, little interview, if you follow us on TikTok, we found out, and we were all surprised that Dr. Cotton is an amazing dancer. So don't go follow us on TikTok to see. So let's talk a little bit about your experience with the pandemic and how it's affecting people's mental health. What is going on currently?
So I think there are really two approaches you need to take when you're looking at answering that question. There are the people who don't have a history of mental illness, and then there are the people who do have a history of mental illness. So those who do already struggle with depression or anxiety, or even things like bipolar disorder or schizophrenia, are really being heavily affected by the isolation that we're all experiencing because of social distancing and quarantining. And then people who don't have a history of mental illness, who haven't been seeing a therapist for however long, are experiencing a really difficult time coping with this new normal that we're all trying to understand. The social isolation, a lot of people have lost their jobs. And this not only causes financial problems for people, which is very stressful, but it also can create an even deeper sense of loss in that people are losing that feeling of being productive and contributing to society that is so important to us all.
Right. I want to kind of explore a little bit more about, the people suffering already with mental health, whether it's bipolar and whatnot. One of my brothers is actually schizophrenic. What can family members do to help, if you have someone in your family that has existing mental health issues?
I think one of the main themes that I'm noticing in my own patients and the patients of the residents that I supervise is that people are feeling very isolated and very lonely. There is a mounting sense of loneliness that is very powerful, especially when you already struggle to cope with stressors of daily life. One thing that families can do is, number one, reach out. Especially when I'm doing well and I feel like I'm having a good week, I'm going to be reaching out to my family and saying, how are you doing? And not just how are you doing, how are you handling this stress? Is there anything I can do to support you? It's important to ask specifically. And if you start to notice people that are struggling, it's important to ask the tough questions and see if they need to get more help.
I like, and one of the things that I just listened to you say, and I think it's important, when we are having a good day and we make that phone call, we can help, the person on the other line kind of
absolutely
feed into that positive energy. So I think that's wonderful. So for people that haven't been diagnosed, what signs, and I'm diagnosed with like any other mental health and illness from prior, I should say, what should they be watching for? Are there any signs and symptoms that they should look out for?
Definitely. Depression and anxiety we're finding are the most common things that people are experiencing. And those are really more than just feeling sad or just feeling anxious or worried. Depression can present with a number of symptoms. A lot of people experience sleep problems, so trouble falling asleep, trouble staying asleep. A lot of us will experience early morning awakenings where we wake up at 3, 4, or 5 in the morning and can't go back to sleep. And then with that can come changes in levels of energy. So people don't feel like they have enough energy to get through the day. They don't feel like they have enough energy to concentrate on the tasks that are at hand. Another thing that people will experience is a decrease in appetite, especially if people start losing weight unintentionally. That's a sign that depression is setting in. And of course, any thoughts of death or dying or attempting or completing suicide, those thoughts lean more towards an emergency type situation where when people start really thinking about suicide or making a plan, they need to call 911 or go to an emergency room.
Right.
It's never too early to seek help.
Exactly. And I think, a lot of people always wonder when they should seek help. And I know that that's a tough question to answer, but when should they? If I'm a person that hasn't had a history of mental health disorders or problems, when should I seek help?
Well, I may be a little biased because I'm a psychiatrist, but I firmly believe that everybody could benefit from a little bit of therapy. So it's really never too soon to reach out. If you're struggling, it is never too soon to find a therapist or reach out to even your primary care doctor, and just have that conversation.
That's a good point. And I'm originally from Puerto Rico, but grew up in South America. And in South America, and in Paraguay, Uruguay also is where my parents are. Seeing a therapist is more like seeing a coach, like a life coach. And so I wish that the United States would catch on to that. But let's talk a little bit about coping behaviors, because there's a lot of, talk surrounding coping behaviors and some of the bad ones. And let's talk about some of the good ones.
Some of the good ones, I know this may seem like common sense, but it's a lot easier said than done. Just maintaining basic health practices, eating good food, making sure that you're getting enough protein, getting enough, bright colored vegetables, those red bell peppers and the spinach and things like that with the vitamins that you need to support your body. Drinking enough water. Many of us are at home all day, we're working at home, and we're out of the routine of being at the office and keeping that large glass of water on our desk, or going to the water machine during breaks. Also staying on a sleep schedule. It's very important that we not only are getting enough sleep, but that we don't fall into the trap of staying in bed all day or working from home in our pajamas. Having a routine where you go to bed and get up at a scheduled time, and then you actually get ready for your day. So you take a shower, which a lot of people have stopped doing as frequently. You get dressed.
That's true.
If you're a woman, you do your skincare routine or whatever it is you do. You do your hair. That really contributes to a sense of normalcy that's very important for people.
Right. We talked a little bit about the lipstick game, and this is the problem with the mask, right? I think my lipstick game is okay, but sometimes it gets bad.
Oh, I'm definitely on point. I was ready.
She says, I know I'm on point. Sometimes the mask smudges it. But let's talk about some healthy coping behaviors for people who are, feeling anxious and depressed. And we know that some of the wrong ones, we've seen a large increase in, consuming alcohol and whatnot. And you talked about some of the obvious things that we need to be reminded of, right, to have the schedule. But what other, if you are feeling anxious and depressed, what can you do?
I love meditation. And for many people, that's kind of a scary word, because people think about the monks in Tibet who are on top of a mountain and who have practiced this their entire lives. But really, meditation is as simple as just breathing. If you breathe in through your nose to the count of 4, hold for a couple of seconds, and then breathe out to the count of 6, focusing on the counting, that's meditation. So clearing your mind, allowing your brain to pause, focus on something other than whatever is stressing you out or whatever is causing frustration in that moment, can actually reset your nervous system and allow you to calm down. So it's as simple as deep breathing.
Well, I do that a lot because I'm a mom, so I think we all share in that.
Yes.
This is, we have a lot of communication with our disease investigators here at the county, at the Washoe County Health District. And one of the conversations that we had recently was about high school kids and the COVID, what they're calling kind of like a COVID shame, if children have not been in school, whether or not they had COVID or not, but when they come back, they're heavily bullied, and they're kind of treated like they have cooties. We brought this up at a CDC meeting, and the rest of the country hasn't yet realized that it's happening, but we know it's happening here in Nevada. What would you say to these parents and to the schools to see what we can do to help these kids?
Well, first of all, I think it's very important that the schools set appropriate expectations for behavior, which when you're looking at a school with hundreds of kids, that's a huge challenge. But it is very important for the schools to be taking on that responsibility. And then for parents, it's important to teach their kids tolerance, and to teach their kids that this is not something that needs to be just across the board feared. That it's not cooties. This is an illness just like the flu, just like cancer, just like diabetes, just like any other illness that anybody would get, where you want to be compassionate.
Right.
And it's also important for parents to educate their children about what a pandemic is. Why are we wearing masks? That's a challenge for a first grader. It's a challenge for a 7th grader.
Right.
So those little education pieces are very important for parents to provide at home.
Right. I think that's very, very well stated. And I just even thinking about how, the flu doesn't have this kind of stigma associated with it. And it is something that we see every year. And, kids are maybe out for a week or more and they don't come back to that stigma. But we're
Right.
seeing that with COVID, which is unfortunate.
Right.
Thank you so much, Dr. Cotton. I know that there's so much more information and we're going to have to revisit this again. I know that you have to leave, but we're going to come back and talk a little bit more about some of these other questions that the community has about mental health. And don't forget to come back and check out the second part of our conversation here with Dr. Cotton. Thank you.